Hi, I'm Marcus,
And I'm Tudor.
and we are doing a presentation on disinfectants and hand sanitizers and how one choice may not fit all applications. So, there are different uses for disinfectants and sanitizers. Which one is more suited for your application? How are sanitizers different from disinfectants? And how do they differ from one another in terms of each case given? How will the concentration of the solution affect the outcome of the effectiveness? The disinfectants are antimicrobial agents used to eliminate microorganisms, and sanitizers are used to reduce but not eliminate microorganisms from the inanimate environment to an acceptable level.
Our research question is to ask, of the two, disinfectant or hand sanitizer, which would be best for most applications? And if not, we would explain why and with sufficient evidence and data. Our research approach is to use the days and persistence of infectious agent SARS-CoV virus on common surfaces after inoculation, as well as a comparison of disinfectants and sanitizers with their effectiveness over time. Here we are using the persistence on distinct surfaces. Here we present various surfaces such as metal, wood, paper, glass, and plastic. Here, after inoculation of the SARS-CoV virus, the virus continues to persist for various of days. As shown here on the diagram, on metal, it persists for 5, while on wood, 4, paper, 4.5, glass, 4, and plastic for 4 days. Here we are using the disinfectant ethanol to determine the reduction of viral infectivity to the log of 10 as the ethanol concentration varies with the constant exposure time of 30 seconds for every single sample. Here you can see the sample for the concentration sample for 95%, 85%, 80%, another 80%, 78%, and 70%. Here you can clearly see a proportional value where the reduction of viral infectivity to the log of 10 decreases as the concentration is decreased. In this diagram, we are now using a sanitizer. Here we are able to determine that the viral infectivity varies as the sanitizer is used with an exposure time of 3 days. Here, although it has a small concentration compared to disinfectant of 0.0025%, it does show a significant amount of reduction of viral infectivity of log of 10.
So our results. The comparison between disinfectants and sanitizers as the ideal biological agent to ideally cleans a surface with a viral agent with its secondary source. An in-class activity to record the concentration strength of both after a 48-hour period. So our disinfectant control was 100 ppm, and in the end of 48 hours, it was still 100 ppm. The solution with the clean white cloth started at 100 ppm, and at the end of 48 hours, it was at 0 ppm. Solution with dirty white cloth started at 100 ppm, and then within 48 hours, it was less than 10 ppm. We had also done the same with the sanitizer. The control started at 200 ppm, and in the end, ended at 200 ppm as well. Solution with clean white cloth started at 200 ppm. In the end, 48 hours, 100 ppm. Solution with dirty white cloth started at 200 ppm, ended with 100 ppm. In conclusion, depending on the application you will use one over the other. As we stated in our data, it's not one better than the other, but which is the best option for your application. The amount of time the trial is also ran played a factor because though the cloths were in the solution for 48 hours and had a lower ppm in the end, it doesn't mean that they stayed clean for too long.
We would like to acknowledge and thank you to Dr. Susan Milohi for providing us the necessary technique, tools, and knowledge, as well as sources to support our conclusion regarding the matter with disinfectants and sanitizer. And that this has been Tujer and
Marcus,
thank you.
thank you.